Congrats to you guys on the
Jeez, let me
1 year
turn my phone
anniversary. That's awesome.
Thank you.
Yeah. Yeah, that's
Yeah,
huge.
man. Thank you. It's been
It really truly has.
it's been an interesting year.
It's been nice to listen to, like, I mean, especially through 2020. You know what I mean? I fell back on your guys' podcast a lot just to kind of escape and, you know, hear other people's stories. So I'm
That's
loving
cool.
it. Honored to be here.
Yeah, great. Thank you.
Thank you. Well, I'm hoping to find out your cannabis story and kind of how you got. You're currently a patient, a medical cannabis patient. But how did you get introduced to cannabis? Let's go back to like your beginning story, if you don't mind sharing that. I'm always curious. Like,
mine came a little bit later.
You
than
know,
most people. I did smoke a joint with a couple of friends, and when I was like 15 years old. Didn't really spark any interest, no pun intended, but didn't really spark any interest to me, and kind of passed it along. 17 years old, revisited it, and really, really fell in love. I mean, just with everything that it was just I don't know, love at first puff, I guess you could say. I knew it was just something for me. I've never really been a big drinker. You know, have a family that's got a lot of alcoholism in it. Like to have a beer here and there and everything, but it's not something I could do every day like a lot of other people do. So yeah, this was just something that was for me. I mean, and 17. I know it's a lot older than a lot of other people you hear, you know, the 13-year-old, the 14-year-old stories and stuff, but quite a late bloomer. And just really, really liked it from the beginning. I knew it was something that was for me, you know, and then I really kind of wanted to educate myself on it more. I knew a lot of other people were just treating it kind of like a have fun, party type vibe. I really kind of wanted to know more about it, you know, I mean, and this is back in 2002, 2003, and it's just evolved so much, and I love learning more each and every day.
Yeah, you grew up in Utah too, right?
Yeah.
So you said
born and raised here in Utah. Yeah.
So you said 17 is a late bloomer.
Oh, really?
Gosh, I was like 24 the first time I smoked weed. I mean, is 17 late? Is that considered late for people to consume?
That I talk to, they are really super young. I mean, I hear some people talking 10 years old, 11 years old. I'm just like, wow. I'm thinking of what I was doing around those ages, and it wasn't even like a thought. You know what I mean? It wasn't a thought to me. Mm-hmm. But I get a lot of people saying that I was that late bloomer, and they're like, wow, that's 17. It's pretty old. And
that is kind of it's kind of interesting that people have different. I mean, really, is it the world we live in now, right? Chris, you and I and Derek, we kind of live in this world where everybody around us uses cannabis, and you know, it's just part of our life. And so, for you, Derek, to say, "Wow, 17's kind of late," well, in your world, I guess so, right?
Right. Yeah.
But what's quote unquote normal?
That's
right?
a great. That is a great question. It really, truly is. I mean, I got kids myself, you know, so I look at like what is a good age for anybody to partake in any kind of thing like this, and what is normal. You're right. I mean, because some other people see a younger version as normal, where others see, let your brain develop, obviously.
Right.
But
right.
What is normal?
I'm going to be in that.
I'm
going to be in that crowd, Derek. I'm going to be in
true.
25. If my kids ever listen to this episode, you can try cannabis when you're 25. Children.
Exactly.
Okay, not before.
Yep. Yeah,
we let that frontal lobe
my
develop
kids too.
all the way.
Yeah, they'll hear it.
But there are plenty of people who need, an endocannabinoid like stimulant.
Oh, 100%.
Before that. So
100%.
So there are places for it before you're a fully functional adult.
Right. Yeah, it does offer a lot. I mean, it offers so much. Like I mentioned, I educate myself so much and dive so deep into stories. Obviously, like I said, I have kids. I've been an advocate for cannabis for so long, and then I became a dad, and now I see myself as a dadvocate. Like I educate my kids. Yeah. I like to educate my kids too. I have a 10-year-old and a 5-year-old. They know what daddy what he does. They know what my passion is. They've sat down and watched stories, Charlotte's Web, the little girl Charlotte's, this new one that we just seen, that was called Waldo on Weed. Really touching little story also. 6-month-old child that had rare cancer in his eye, and parents picked up cannabis, CBD oil, and completely changed everything for this little boy. So you are right, It's called Waldo on Weed.
Where's that video at?
On Amazon Prime. The name itself just kind of pulls you. You see scrolling across, you see Waldo on Weed. It's like, I got to check this out. And it's a great story. I highly recommend it. Yeah.
Yeah, I think
I'm going to watch that after we're done here.
I don't know if I could make a universal statement about this, but I'm trying to organize my thoughts here around it, because you have cannabis, medical marijuana, you have alcohol, you have guns, you have sex, all of these 4 things that we talk about with kids. And it does seem like in every case, more education and more openness leads to better choices in general, right? You hide the booze from your kids. What do? They go try to find it. They drink. Hide the guns from your kids. You don't educate them about them, and they go use them in bad ways.
Yes.
Same thing with medical cannabis. Sex, right?
Yes.
Utah classic for that discussion,
yeah.
right?
Yes,
we can't teach kids about sex education in school. We have to teach them about abstinence. And what do we get? We get high pregnancy rates in teenage girls.
Yes.
Right? So because we don't know how to use protection.
Right.
Right?
Yeah.
So cannabis is the same kind of discussion, right? Be open with your kids about cannabis in a good way. Maybe we should give me a good idea, Derek. Maybe we should write a book, a kid's book. What's in Grandma's Garden is a book.
And oh man, I love it. Grandma's Garden. I love that.
It really is. That's actually a real
Wait, is that a real book?
Amazon. What's growing in Grandma's Garden?
I thought we had a deal.
And it's a weed book. How to teach your kids about cannabis and
nice
and like a legitimate way.
That's awesome.
Yeah, I'm an Amazon Prime.
That's awesome.
And, gonna be on the next book list.
So when did cannabis come into your world, Derek? Like, when did you realize you could use it like on a medical level, more to help your body out instead of just recreationally?
This, for me, I do fall victim to a lot of the what a lot of people here in Utah fell victim to, a lot of the country in itself, the opioid epidemic. While back, a few years after high school, I'd say about 2006, 2007, was, running with some wrong crowds, fighting, doing some damage to my hand, broke my hand 3 times, shattered it, required surgery on it. It was too late. I had done too much damage to it. Typical story, doctor was just pumping me full of so much medication that I didn't need. I was going and filling my prescriptions at pharmacies, and the pharmacist was asking me, mind me asking what this is for? I'm telling him it's for my hand, and the pharmacists themselves are telling me this is way too much for you. And, younger kid right out of high school, I'm just taking what the doctor's prescribing me. Little did I know it was creating massive damage to my body, to everything. I became so dependent on it that when the doctor was just like, oh, okay, this is the amount of time, we're just going to take you off it. There was no weaning off process. My body became, obviously, went through withdrawals and had no idea. Like, I'd never really been addicted to pills. I'd never known what that feeling was. Used cannabis recreational before that. Was really never too familiar with any other drugs besides alcohol, and didn't really know what that was doing. At a young age, I was scared. So I started looking for my medication elsewhere on the streets. And at that point, I wasn't even helping the pain. I was just helping the pain from the withdrawals by seeking medication through the streets and everything. So that had turned into a quite lengthy addiction, ranged for about... So
how long ago was this for you?
2007, when I had got on the pills for the second time. I had seen 2 different doctors from 2 different breaks and shatters on my hand. The second one is one it just cranked up. I mean, the first one I was on like some Percocet, some low-end stuff. Second one, it was Oxycontin 80s, and it just got out of hand. And from about 2007 till about 4 years ago, I've been off everything opiates clean for 4 years, all thanks to cannabis. It just went downhill, and I seen things in that time and went through things that it was just no person should go through. I mean, it was losing at least 2 to 3 friends every 6 to 7 months, it felt like, all to overdoses. I became numb to it. I had not lost a family member, until I was like 26. But in that 26 years, I had lost at least 15 friends during that time, in just a short period of time, all to overdoses. My parents, my dad still talks about it to this day that, my friends have set a record for, just bodies just going down on all to opiates. And, cannabis was something that I had obviously used before. It's something that I used obviously just recreationally. Like I mentioned, I tried to educate myself on the benefits of it before, but never really knew the medical standpoint until I gave myself an option to look for other ways to get off this medication. I did do the typical rehab. I went to rehab. That didn't work. I was doing Suboxones, methadone, terrified of that. I know that they have the programs. I know it works for some people, but that stuff's just as hard to come off of as opiates are. And I think any person that's on it right now can tell me that's the truth too. So cannabis was something that I really took a shot at. I had tried so many different things, the Suboxones, the rehabs, and just told myself, I'm going to have this pain. Like the doctor said, I'll have this pain in my hand the rest of my life. It's just plain and simple. And, in the wintertime it gets even worse. Utah's can be winter in March or winter in April, so it's really hit and miss. But, cannabis really stepped up for me, saved my life. I truly believe it, and I owe it all to it. I educate a lot of other people that there's other options out there, and this is just, I feel like, the best alternative for anybody that's looking to get off opiates.
How did you switch from opioids to cannabis? Like, it sounds like you've been a cannabis user for a while, right? And that's always been part of the equation.
Yeah.
But at some point there was this idea that, look, I've got to get serious about getting off the opioids. I've got to get serious about using something else, or like, what does that look like?
I'm glad you asked it, and by all means, I'm not ashamed of anything. I'm not here to glorify anything. The glory from my story comes from me getting out of it, plain and simple. I tell this story to a lot of people because they ask, just like you did, how did you do it? I was so deep, had tried so many different things, and what was the wake-up call? I had switched from Oxycontins, just like a lot of other people, to opiates to heroin. Was using intravenously, IVs, shooting up and everything, and just this one day, it was just the weirdest thing. I still don't know what it was. I tell a lot of people this; they have their own thoughts on what it was. As I was ready to use again, I was just sitting there, and do you guys kind of know the feeling like if you stand up too fast, you get like tingly in your body?
Mm-hmm.
Okay. So I was sitting down. I was completely fine, everything, not withdrawing or anything, and I could just feel that feeling going from my forehead all the way down my body, just this tingle feeling, and it was like a snap of reality, and I just remember asking myself, is this it? Is this what you want to do the rest of your life? Is this it for you? And I said, absolutely not. I broke my needle off, threw it in the garbage, picked up some cannabis, and told myself, I am going to beat this. I'm going to get through this. I told my mental states that it needs to take a back seat, because I know a lot of it's mental when you're trying to get off opiates. A lot of it's obviously physical as well, but I truly believe if you can overcome the mental state, you can fight the hell out of it. And I chose to. And through the withdrawals, through the pain that I was suffering, cannabis was the thing. I had my humor back. I was eating. I was sleeping. all of the things that a lot of these doctors can prescribe you, but there was no side effects from it. You know what I mean? There was really, the side effects were hungry, happy, sleepy. All things that I could deal with. All things that were just perfectly right up my alley. So, that was 4 years ago, 2016, November of 2016, November 27th, and haven't looked back since. And cannabis has been not only the thing for me, I've helped a lot of other friends that have been in need. I know a lot of people see me and they're like, wow, he did it, and they have questions, and that's the only answer I can give them. I don't know what else it was. I don't know if I would have made it without it. I truly, truly don't.
Tell me why do people go to heroin from the pills? Like, how does that happen?
That transition came, honestly, I can almost remember the day. OxyContin really took off. I can't remember around what year it was, but it really took off and was just creating damage everywhere. I mean, all over from every corner of the country. And I remember when they took it off the shelves and the company just said, we're done with this. And they were like, it was like Willy Wonka's golden ticket. Nobody could find them and everything like that. So that was a huge transition for everybody, is that that became unavailable. So somebody else just said, hey, I have this other thing, cheaper and just as strong. And so once that, settles in, it's just off to the races with that. And
I've heard that the same thing, that it was actually
damaging.
it's actually just cheaper.
Yeah,
in a lot of ways
completely,
too. It's like
completely.
It's easier to get in some ways, and it's just plain cheaper. You can't afford the pills.
Yeah.
So you got to switch to heroin.
Yeah, and it's dangerous. But even more now, though, with the fentanyl that's came in. I'm just so glad I got out when I did. It's a blessing.
It's interesting too how people can label marijuana as a gateway drug when you're using it to get off of drugs. It's like, how does, why can't we get people thinking that way?
Time, and when you have one of those ideas and then you're just like, this is such a great idea, and then you go to look it up, or you don't even go to look it up and then you just see your idea. They have a facility. I've always thought that, for these drug and rehab facilities, that they give people methadone, Suboxones to help them detox. Mm-hmm. I've always thought, why has no one ever tried cannabis to give these patients? There's a place in, I believe it's California, called THC, the Heavenly Center. A music producer, Scott Storch, helped fund it and everything, and they use specific cannabis to get people off. Matter of fact, I just seen today there's a center here in Utah that I believe is doing that now, that is introducing medical cannabis to people who are trying to get off opiates. So it's amazing to see that people are taking a shot at it, because I truly haven't seen it fail. I'm a person that's speaking, the truth from it, and anybody else who has kind of taken my advice, they're right here with me, and it's a blessing to see. I every time that I can see how it can heal anybody, it warms my heart. It truly, truly does.
What's the difference between the high associated with opioids or heroin and the feeling of cannabis? Because I've talked to some people who've come off of alcohol, right? And they'll say, well, I still get that craving, and it's different. It's not the same relief as the alcohol is.
Yeah.
Do you feel like how does that work with cannabis and opioids, or cannabis and heroin?
Yeah, it's a good question. I honestly, for the longest time, and this is probably true for a lot of users, I was never really getting high in the end. I was just getting by, and I was just getting better. A lot of addicts would chase that high. I never wanted to chase it too much, because that's how you overdose. You can overdose off of a small amount, but a lot of people would chase it so much and push the limit. It was just kind of to get by for me. It was really not necessarily taking away any pain. It wasn't giving too much euphoria. But I do remember smoking cannabis while I was in the midst of an addiction, while I was in the middle of it. And just kind of to quote Bob Marley on it, when he says, the cannabis helps reveal you to yourself. I remember smoking while I just got done getting high off opiates, smoking some cannabis and thinking to myself, why am I doing this? Why am I using these opiates? Like, I would literally have conversations with myself and think, this is so stupid. And I was so close to, like, those were the close times that I had to full on stopping and quitting. So I knew that when I had that, that kind of rollover and just said, hey, is this it for you? I knew that, hey, every single time before you smoked, you would always ask yourself, you really got back to you. And that was the truth. So there was really not much more of a difference. I would say credit definitely would go to cannabis. I mean, it would obviously get you high, but it wouldn't, to me, it was just more of a spiritual type thing. It was more of, this is real, this is safe, there's more of that, like, hug kind of high, more than that, like you're just out of it kind of high. I felt the embrace every single time. But sometimes the opioids were really too strong in the moment. But since then, yeah, I mean, it's, like I said, it's a blessing. It truly is.
How much, now that you know what this process looked like for you, think about, like, all of the knowledge of cannabis, right? You started when you're 17, you're in your mid 30s now. You've come a long ways, right? You've learned so much about cannabis. Could you design a program better now to get somebody like you? Like, could you go back to you and be like, hey, 4 years ago, you'd be like, hey man, Derek, you know what? You're using this strain. No. You need to be using this in the morning. You need to be using this at night. You need to be using this tincture here. Mm-hmm. Like, what's that look like now that you know?
Now that I know, I just want to know more. I truly, truly do. I believe I've become such an advocate and such a promoter for this that a lot of people around me that talk about different things, that's whether it be neuropathy, whether it be diabetes, whether it be pain, whether it be anxiety, I feel like I am starting to educate other people on what's, hey, this is what you need. Hey, maybe you need CBD. You don't need THC. Maybe you need some CBG, you know what I mean, for inflammation. There's a lot of different things. So I'm more trying to create this kind of program for myself to help others, to really kind of pass the message of cannabis on. Not only just for myself, for the loved ones around me, but for my kids. I mean, I truly, like what we were talking about in the beginning, what is normal for a child to start taking something like this? I can see my kids taking CBD at a very young age, given that if they need it. There's just a lot of options outside of big pharma that people need to take a look at, and they don't need to see this as the last resort. It's very tough for me to hear when people are suffering through certain things that they say, we don't have any other choice, so we're going to try this. This is our last resort, so we're going to try cannabis. It's tough to hear. It's also good that they're giving it a shot, but this needs to be the front line.
Yeah,
I mean, it really
top
needs to be the
three
front
instead
line.
of the bottom.
Hands down.
Right.
What's your favorite way to consume
I've
cannabis?
Like,
what's your favorite?
Kind of the art form of a lot of different things. I used to roll sushi and everything like that, so rolling joints was a thing of mine. I mean, it's for me and my friends in the past. We tried to roll the best and everything. I really do enjoy the vaping now. That to me back then, it was when somebody had a vape, it's like, no, what are you talking about? But there's so many benefits from it, from the vaping. Edibles, I've really trying to train my body on them, more or less. I'm understanding a lot about how they work with metabolism, with lots of different things that you eat. So that's interesting to start kind of working out the doses on that. But I mean, just really all things. It's just there's so many different things that work on so many different levels. But yeah, for me, I love the taste of the flower. I'm a flower child at heart, really. I love where cannabis is going, extracts, tinctures. I love where it's going, but more kind of the old school flower child.
Yeah, there's something about it, Chris. There's something about there's something about the flower, right?
It is.
Right.
It's
Just
That
that little
experience.
stickiness
The
and
beauty
just
of
that
it.
breaking
There's that-
off. and-
There's that experience
Yeah.
of grinding it, of rolling it, of
Right.
putting it in the vape if that's the way you consume it. I mean, certainly there's a lot of people who still smoke it in Utah, even though it's really outlawed. But yeah, that's the thing. Would you want to grow it on your own?
It's always been a dream of mine. It really has. And I mean, especially with what I've kind of been talking about is, offering this as another alternative. I would love to figure out the perfect, I know there's great strains out there for people that are coming off of opiates, but just one that's just going to be the end-all, be-all that, a lot of other people can say, this is going to be the one. You're coming off of opiates, no, not Suboxone, not Methadone, it's this particular strain. So,
that is a high goal. That's a really cool project, though.
Yeah, it
right?
really
The
is.
right ratio of cannabinoids, right? Even down to that, where you're going, okay, maybe we don't need a 30% THC strain. We need a 12%. We need high CBD. We need
high CBD. Yeah.
We need that. That anti-anxiety.
Somewhere around the lines of the ACDC strain. I know that's a kind of a 1-to-1 strain that's kind of rare out there.
I've never. I've never seen it. I don't know.
Yeah, and you don't.
Right?
I mean, a lot of people are just looking high THC. They just want them 30%ers, and there's more benefits in, CBD, CBG, CBN, so many different things that people need to take a look at.
I know it's always interesting in a lot of the online forums. People get so bent out of shape about, low THC. The flower in Utah is just too low, and I'm just like, I don't know. It's
we had some.
It's not all
we
that
had some
bad.
discussions today with Justice Grown, and they're talking about this program as a real medical. This is a really medical program, and medical programs, they're not the same as adult use programs. We are not going to have the same products that they have in Colorado. We're just not, and that's it. Yeah, and
they just need to bring that price down, though. That's what's hard to keep it as a medical thing, because it's like people can't even afford it.
Indigent patients out there that, I mean, some of these prices, man. I mean, I work and I have kids and everything like that, and my dispensary buys are just enough. But yeah, a lot of it is high. I'm just thankful it's here. I truly am. I remember watching when Prop 2 was getting passed. I literally was up refreshing my phone all through the night. Like, come on. And blessed that it's here. I know it's gonna. I mean, there's a lot of kinks in the system and in the program right now, but I'm very hopeful that they're gonna get it worked out. I think it's just gonna get better. But prices. It would be great. I mean, and I was really looking forward to. I mean, if patients were able to grow, because that is just a huge thing. I mean, I heard your guys' Bob Waters episode. I mean, shout out to Bob Waters. That was amazing. I would love to get in touch with him. So. We can link that
Bob.
up.
But he brings up a good point, right? It's $24,000 for his medicine per year,
right?
And it's not covered by insurance, and it's like $20 to grow his medicine.
Yeah, and I thought about that 24,000, and it just made me think, like, wow, how much is mine? Like that number just kind of put out there, like, wow, his is a lot, but some are probably a lot more. But it's still just a lot of money. I mean. In itself.
And people are going to look at that and they're going to say, well, I mean, it's just like a bad habit, right? They're going to compare it to smoking cigarettes. Well, if you quit smoking cigarettes, you'll save all this money. That's different, right? It's medicine.
Completely
It's not the same thing, right?
It is. Right.
We have people with chronic pain that require this substance. And we subsidize that with insurance for all other medications, but we have no way of subsidizing it for cannabis.
Right.
Right?
Yeah. Yeah, it's just amazing. I mean, if people were able to grow it, I think it would it's so much more of a benefit. Just being around the plant. I'm sure you guys have felt, the change and just being around the plant. You just feel a difference and everything. But, yeah, it's medicine. And if a person can grow their own medicine, like, why not? You know what I mean? Like,
sure.
I wish diabetics could make their own insulin. That would be amazing.
Right.
Like, there's just certain things. It's like, why restrict those things? But again, I mean, I don't know. It's kind of
we're not. Yeah, I mean, we're not the people who make the rules. We've got to live by those rules.
Hopefully one day here in Utah, they'll at least allow the people that are way out in the boonies.
I think it's my understanding there's going to be another retail license that gets out there, and that's supposed to be designed for the rural market, so that there's more access in those parts of the state that really have had a hard time with access so far. Because if you look at where you've got to travel to, anywhere south of Provo, you got to go to Provo. You got to go to Deseret Wellness. Mm-hmm. There isn't anybody south of there.
Yeah.
There will be, but still, man, it's a long time coming.
Yeah,
to get these guys open.
The program's been up for a little over a year now, and it's all those patients down there. I mean, you're pretty much forcing them to cross state lines, and it's a terrible thing. I mean, it's a terrible thing. You think of all these people that have never broken a law in their lives, willing to risk their lives to go get their medicine across state lines because they have no other way. I mean, that's a terrifying thing to think of,
Sure, and this is legitimate, right? I mean, you talk about coming off of opioids, and I can talk about, 70% of my patients are reducing their other medications by using cannabis as an adjunct, as an addition to their medications. That's a big deal.
Yeah.
We want more of that data. We want to drill down on that, but that's a huge number.
Completely.
7 out of 10 people using less other medications, whether that's alcohol, opioids, sleep, Ambien, with less long-term side effects in most cases than the other harsh medication. But then again, the issue is price. You got to go buy it on your own. You can't even use tax-deductible funds like your health savings account to go buy it.
Little things like that would really step up and make a big difference. I mean, and people are going to have to start looking at this. I know probably medications are a little bit cheaper. Yes, you can use your insurance, but 2020 itself, I can see a lot of mental illness coming out from that year alone, and people requiring cannabis. That was a tough year for everybody. I mean, everybody should have got a qualifying condition card just that year alone, just to help us through it. I mean,
if you survive 2020, you qualify. That should have been in the legislature.
Completely. I
love it. The 2020 qualifier.
Yeah, it should be. It should be a qualifier for everybody because, it's something that people really need to open their eyes on. I mean, it's not the taboo dope that it used to be before. And I know that people used to throw that word around and call cannabis dope, and that's probably one of the biggest pet peeves of mine. It's not. It's so much more. And it's on its way. I'm happy to see it. Always happy to share my story with anybody. And I mean, anybody who's suffering, who hears this or anything like that, they can feel free to reach out to me because I'm always there to talk. But just like I tell everybody, I'm in it as much as you are. I'll help you as much as you're willing to help yourself because it has to come from within. I mean, a lot of people are scared, but there's better options for everybody. And this was the one for me that completely saved my life. Absolutely.
What about your family and friends? I mean, are they pretty supportive of you using cannabis, or do you kind of keep it hush-hush?
My mom and dad, bless their hearts for going through what they went through and everything. It's something no parent should have to go through, having a child as an addict. It's terrible, but we made it through it. And they're huge, huge supporters. My mom was really, it's drugs. She's never taken drugs in her life, never smoked a cigarette. She has wine from time to time and everything, real, kind of straight-laced upbringing and everything. So something like what I was going through and cannabis, it was just all wrong and all bad. So she got to see what I went through, and she got to see what cannabis did, and she I can't even say the word 180, it's an understatement. I mean, she's so supportive of it. it always just, it warms my heart just to hear how on board she is with it. She tells people how much it saved my life. She's fully supportive. She doesn't look at it differently now. Years ago, if she would have found out how I, educate my kids on it, she'd be like, wow, they're, absolutely not. It's so wrong. But she, my mom's always, she was the biggest change. My dad's always been, supportive. He uses it himself also for his depression and everything. And but for her, she didn't understand it. She never understood the benefits of it. My friends, they see what it did for me, so they have no choice but to see that it helped. They always have questions about it, like Tim was talking about, what strain did you use and everything. And at that time, I was, getting it from friends. But that's the great thing now is I know exactly what to use. So it can help a lot of other people by, educating them. But I do have, a couple family members that are, how do I really put it? Not necessarily judgmental towards the fact, but they don't understand it. They're not educated themselves yet. And that's all I can say about it is that, they just don't know enough to kind of fully understand what it's doing. They've always seen other things as other options, so they still don't believe that this is the end-all be-all for me or anybody else. But, for the most part, everybody's super, super supportive. They know how passionate I am about it. My kids constantly asking me different things. We watch shows like I was mentioning before. So, yeah, full-on support from those around me.
Yeah, that's pretty cool. And I think that, the family members you talk about who aren't supportive, you're right. It's this really a lack of education, but it's got to be a lack of willingness to admit, or to maybe not admit is the right word, but it's this understanding that you don't know.
Right.
Right? This acknowledgement of something you don't know about. And so I'm going to go out and find out about this.
Yeah.
Right?
Yeah.
It's thinking. And I guess that's kind of judgmental to say, yeah, if you don't think cannabis can be medicine, then you think but kind of you really don't.
Yeah.
Right? You've got to be willing to learn.
These are the same people that are the wine versus weed kind of things. They partake quite a bit in the alcohol and see that as, hey, it's right what I'm doing. It's legal what I'm doing. Well, it's also legal what I'm doing also. Mm-hmm. But this is something that's new that you guys have seen taboo for so long. And I try to, I don't like to get in debates too much, but it's something that I will always debate people on. I feel like I'll always stick up for cannabis, and I can argue with everybody, but what good does it really do for somebody who doesn't really want to learn themselves? But alcohol, you look up top 10 dangerous drugs in the world, alcohol will be top 3 in every single list that you find. You will never see cannabis close to one of those lists. But it's legal.
Yeah,
but yet alcohol is legal.
Do you feel like, to turn this a little bit, do you feel like there's some danger to excessive cannabis use? Do you feel like people can get into using too much and really not be good for their health? Do you feel like you ever got into that spot?
Great question. I don't feel that I've ever really got into it myself. I'm a firm believer in that it's really not for everybody. But at the same time, I kind of fight that it's not for everybody, because I think for the person that tries something, that experiences something bad, whether it's high anxiety, paranoia, you just hear all these stories where it's just a terrible experience, or they use it in excess and something kind of changes. I think those people need to be educated on what they're using, and maybe find out, like we were talking about, what works best for them. Maybe you're taking a 30% when you don't need a 30%. You need something lower. Maybe you don't even need THC. Maybe you just need CBD. I understand people play with cannabis as it's like alcohol, so people will partake in it just for fun. But at that point also, it's still good to educate yourself on what you're using.
You don't go to the bar and just say, "Hey, just light me up.
Whatever.
Just give me whatever. Give me as much as. Give me 3 hits of that."
Exactly. Great.
Right.
Yeah, great example.
You order a drink, because you know what's in it, you want the taste, you want
exactly.
right. It's the same. It's got to be the same with cannabis from a recreational standpoint, right?
Absolutely.
You got to know what you're
Absolutely.
doing. And
Absolutely.
I bring that question up because I do think, like in my opinion, there is an excess to cannabis use. I think people can use too much. I've definitely met some patients who, in my opinion, they use too much. I mean, if you're using a gram a day and you don't have like a serious cancer pain or something, man, I mean, lowering your tolerance could be beneficial to your health.
Right.
So this balance, right? Cannabis is a substance. The endocannabinoid system is a system that tries to find that balance.
Of course.
That's really what we're trying to do with medical cannabis is we're trying to bring the body back to homeostasis, that evenness. And so I think that in any case, and the Mormon Church is really into this with the word of wisdom, and that is finding this balance, no excess, right? So
Correct.
I don't know. I'm getting a little on my soapbox here, but I think you can use too much. But on the other hand, educating yourself about what to use and how to use it, that's okay.
Absolutely.
That's a
Absolutely.
good thing for people.
Absolutely. Anything can be used in excessive points. I mean, it comes down to personal control at that point. But yeah, I mean, I 100% agree that people need to know exactly what they're using because that's when I think it can get out of control and out of hand. I mean, it doesn't even become medicine at that point. You know, you're just rolling the dice and just figuring out, hey, let's see where this goes and let's see where it takes you. Just like you said, you know, here, bartender, fill me up. You know, nobody does
right?
that,
You don't know what he's even pouring.
Yeah.
Right? Surprise me.
Nobody does that.
That's a bad
Surprise
idea.
me.
Yeah, that's a bad idea for no matter what you do. So how do you get? So now you've come all this way, and you know what's next for Derek? Because I know you're really now working in the industry.
Yeah.
Right. I mean, is that what's next?
Yeah, it's a blessing. I mean, I don't even feel that I go to work every day now. I truly don't, and I know that it's a blessing all around. I mean, my kids see this excitement. My fiance sees this new side. I mean, it's just what's next for me is just to keep on going, keep educating myself, and I would love to continue to help educate other people as to, like we talked about, cannabis is not the entrance drug. It is the exit from a lot of things. I mean, and people need to look at it different. So what's next for me? The sky's the limit with this. I truly feel more at home being in this industry than I've ever felt in anything in my life. I mean, you can ask my dad. It's been a struggle for him. I've had every job underneath the sun, trying to find my way, trying to find my home. And this is it. So, I mean, I'm just going to continue to grow. No pun intended, or pun intended, because I may be growing one day. So. But yeah, I know that this is something that it's beneficial for me in so many ways, other than just being a medicine. I love being around it. I love educating people. I love what you guys do. I mean, this type of podcast is so needed to educate people from, I mean, all stories that you guys have, business people to patients to whoever. I mean, everybody needs to tell their story about how this has helped, changed, shifted, done anything in their lives, because this is a life-changing situation. And being in the industry itself is life-changing for me. This is a career. This is not a job to brag about. I'm not just a pothead trying to make a point. I'm here to help heal and educate and show people that it works, because I wouldn't be here having this conversation with you great fellows if it wasn't for cannabis. It's a fact.
That's cool.
Yeah.
Absolutely.
I'm grateful for cannabis. I'm glad to be sitting here with you chatting and finding out your story, man. Are you on Instagram? Can any of our listeners connect with you, like through Instagram or anything, or do you have a website what?
I am
How?
on Instagram.
Let's share some of that information.
_Deuce, DEUCE 801. One of my other passions, DJ and stuff. So yeah, I'm on Instagram, and like I mentioned, anybody who's kind of going through, the struggles, can definitely reach out. I'm always happy to lend an ear or to help out.
Yeah, I'm going to get you on our Facebook patients group if that's okay.
Absolutely.
And then, at utahmarijuana.org, we've got a Facebook group, a patients group, that people can reach out to others and kind of, just get a sense of what this is like for somebody else, get a little bit of back and forth. I think a lot of people, they need that here. There's a little bit of isolation here, especially, you don't want to go talking to your neighbors in some cases.
Yeah, it's
right?
hard. It's hard to reach out. It was hard for me. I kind of had to reach out to my inner self and have that conversation with me. But, yeah, I'm always here for anybody who kind of needs the help.
So
Yeah,
glad
the
I brought you on
take
the
two.
podcast, or that we brought you on the podcast here, yeah, I mean, I know it's been a couple of times.
It's
I mean,
all
last
good. It's all
week we
good.
tried, but
I
my
like the
internet
take
was
two.
out.
The
I
number two is
apologize
very
about that,
synonymous in
man.
my
It's-
life, so it fits now. So I'm happy.
Yeah, perfect.
I'm happy with it.
Yeah. Yeah. Very cool. Well, anything else you want to ask him, Tim, or anything else you want to bring up, Derek,
No,
before
I
we
think
wrap
I'm
this
good.
episode
Again,
up?
Congrats
Or
to the 1 year. You guys
anything?
are doing an amazing thing. I literally can't get enough of this
Thank you.
podcast and listening. And shout out to everybody who's been on here. I enjoyed all the stories all across, and always looking forward for more. It's going to be awesome.
Cool.
maybe eventually one day we
have
can get everybody
yeah.
together and we
Hey,
can all
that'd be
just
awesome.
have a big giant vape together.
I'm
right?
thinking 420.
I was going to say pass around a joint, but we can't do that here in
422.
Utah, you know.
Oh, I like it. I like it.
Maybe just
424.
yeah.
Oh man, we better have a big
got just
420
a
party.
little
when,
while longer.
Almost.
Very cool. And everybody can go listen to all the other episodes of the podcast at utahmarijuana.org/podcast. You can listen to them right on the website, or you can subscribe to the podcast in whatever podcast app you listen to all your other podcasts in. And leave a review if you haven't left a review in Apple Podcasts or wherever you listen to podcasts. Anything else you guys want to say, or let's wrap this episode up and
I guess so. Well,
go on with our
thanks
lives, I
for
guess.
listening.
Of course,
Chris?
shout out to everybody in the industry, everybody at my work. You know who you are.
Yep.
You guys have a great night. Keep on
All right.
doing what you're doing.
Stay safe out there, guys.
You too. See ya.